Dear students, today I am going to teach you one topic that is called as Dystocia Dystrophia syndrome. So, what about that? I will explain you. In this, what happens in Dystocia Dystrophia syndrome? First of all, the women's become short. Means height of the women is very short, and she becomes fatty. That is obese patient, and also she becomes stocky in the sense that very the muscles of the body of the women is becomes hard. So and the another thing is that the women develops hairs like male patterns, like male patterns of distribution of hairs used to be there in that fashion. Male patterns hairs develops. For example, the women's does not have hair on their face, and also mostly does not have hairs, hard hairs on their upper and lower limbs, this hands and feet. But in dystocia dystrophia syndrome, the female or women develops male patterns here, like they can develop hairs on their bilateral upper and lower limbs. Also they can develop hairs on their face. And another thing is that the shoulder of the women's becomes broader than their hip. And normally what should be there, the women should have a broader hip compared to shoulder should be less wide, and the hip should be broad. That is should be wide, very much wide or broad in normal women's. But in the disease condition like dystocia dystrophia syndrome, the shoulder of the women's becomes broad. And another thing is that the women's have equal length of the fingers. Normally the fingers, that is middle fingers and ring finger should be long, and little finger and index finger should be short. This is normal case. But in case of dystocia dystrophia syndrome, all the fingers almost equal in size. And other thing is that the women's get conceive very late, and the conceive whatever they conceived, it later it becomes abort, means abortion occurs. And in whole life they get only a single pregnancy in their whole life. And other thing is that the women's also have prolonged labor pain. Means the labor pain should be started in 9th month, but the labor pain here in dystocia dystrophia syndrome, the labor pain starts just from 3 months or 4 months. Because of this reason only abortion occurs. And the another thing is, in this condition the uterus becomes weak. The uterus inertia is common. It means uterus becomes very weak. Because of this reason the abortion occurs. When the uterus will be weak, it will unable to hold the child, big size of child. So because of this reason also abortion occurs. Means the pregnancy, even though it occurs, but later it abort. So these are the conditions in which we can say this is dystocia dystrophia syndrome is there. Okay students, for the topics is today up to here. The topics closes, the topics ends, and later on I will come with the new topics. Thank you so much. Okay.